Good evening, Dr. Karki. It's been a pleasure being with you, all of you in Nepal. You work with the Nepal Health Research Council.
Council.
Could you tell us briefly what is it that the council does and what you do in the council?
The Nepal Health Research Council is an apex body for health research in Nepal. So basically, we have three mandates. So one is to regularization of these all researches, health researches in the country. That means, we have to see the ethical issues of the health researches. So we always want to have this research ethics and responsible conduct of research on the researches what the organizations or the individuals they do in Nepal. And the second one is the promotion of the health research and the capacity of doing a research. So this is something very crucial that in Nepal we have a very limited kind of research capacity, we have to say, because because of we can see like it's not the priority for even the Minister of Health or the other universities. It's less prioritized. That's how it's really very important to promote this research capacity in the country. And the third mandate is to translate the evidences, whatever we get the evidences, into policies and practices. So uh, that is really a very important that we need a good capacity to get the evidences as well as translate those evidences into policies and practice. So these are the three issues that the Nepal Health Research Council is trying to promote in the country.
That's good. So, one wing is to make sure that the research that is done in Nepal is ethical and done well, and the
Yes.
others are in terms of translation of
Yes.
research. So, how do you see this workshop that you help to facilitate,
Yeah.
conduct of? How do you see this playing into your strategic plans?
Yes, that is really what I have thought like for the capacity enhancement of the young researchers and the scientists in the country, as well as the get the good evidences and synthesize those evidences and properly translate into policies and programs. We need clear cut capacity for that. So this workshop really, I think, helps to build this capacity of our young researchers, and we will get this group of researchers, the young scientists, and they will be able to handle those evidences in a very proper way, and the that evidences we can synthesize and translate into the policies and programs. So uh, unless and until the having a good capacity, we cannot convince the uh, scientific communities as well as the policymakers, decision makers. That's how we should have a very strong kind of evidences. To generate those strong evidences, we need a capacity. That's how this workshops maybe are very instrumental to build our capacity, so that we can take this opportunity to build our national capacity. And then when we build our national capacity, then the definitely we will have a good ownership of these all evidences, all as well as we will be we will have a sustainable kind of support to the country, as well as to the research community. So this is something the overall expectations from this workshop.
So, some years ago, you all had said that the NHRC will provide a sort of technical support
Yes.
to the Ministry of Health when it tries to come up with some guidelines.
Yes.
How useful has that approach been? Has it?
Yes, we attempted to provide this evidences for health policies, as well as health strategies, and developing this implementation plan. And then when we started working on it, then we realized that we should have a capacity that we can generate these evidences in a very proper way, and we can use those evidences in our policies and the strategies and the implementation plan. So that's how we realize that we should have further capacity to support the government of Nepal, Ministry of Health in a proper way. So this is something we are trying our level best to support the government of Nepal, and we are also getting a good lesson learned that we should enhance our capacity. So that's how we realize that we should have a good collaboration and networking with the international organizations like Cochrane and other. That's how we can get the good support for getting the good evidences for good policies and good programs.
So that's really useful because what I'd like to know is how can we, as Cochrane South Asia,
Yeah.
facilitate this process for you? In the sense, we run a workshop, but where do you see this going from here?
This is really important that this is the I think the foundation stone for us. So this workshops, we have around 20-22 young researchers. So they will get this kind of good exposures. How can do the systematic review and meta-analysis, and we are hoping that these young researchers, they will get at least the four protocol, and they will do a research. That means they will develop their capacities, as well as they transfer those capacities into the other young researchers, students, and the faculties. So that this is the foundation stone for me. And in future, if we be able to collaborate further, then we will have strong support for this proposed protocols, as well as we will develop further protocols to have a good systematic review and meta-analysis, and that ultimately we will get the good evidences, strong evidences that we can use in the country, and also we can contribute that evidences in the global era, also global communities.
So we were very impressed with the enthusiasm of your participants. As
Yes.
you mentioned, many of them stayed up till 10:30 at night finishing
Yeah.
their work, and that's very impressive. So there's a lot of enthusiasm.
Yes.
Do you think that enthusiasm will translate into support? For example, if we were to say, would you like to be a branch of
Yes.
a Cochrane Center, so that you take, as you said, ownership
Yeah.
of using the help that Cochrane can give you, the international community can give you,
Yeah.
to make sure that there is more of a in-house movement?
Yes, that's that's I can ensure you, like the Nepal Health Research Council is an autonomous body, and the apex body, and we have we have been given a strong mandates to develop our research capacity. In that sense, we can get easy permission to get this um, the collaborations, and we can establish this center here, and then we can mobilize some of the resources internally, because Nepal Health Research Council also has the own resources also, and that we can use as a matching fund for that center, and then we can build with that matching fund to further resources. So that's we are hoping, and then the my staffs, the colleagues, and also these young researchers from different universities, they're quite interested to support that individual. So that's how we were trying to get this workshop last year, but because of this mega disaster and the earthquake, it couldn't be happened. But this year we have organized it, and definitely we are quite committed to have a center here, and the collaboration in the future. That's how that is the overall hope of this whole initiation.
So, what I'd like to just I was wondering is we've got started off on this initiative of trying to get people to do systematic reviews.
Yeah.
So that builds their capacity to do it.
Yeah.
There's also an equal part of what we try to do is to get people to use existing reviews to inform their health decisions. And
Yes.
in that, what we do is we try to see whether there are any priority areas for which you would like to revise your existing guidelines
Yes.
or not a policy approach per se, but an existing guideline on how to do a certain thing or how you treat certain conditions.
Yeah.
And that's the kind of work that we can get collaborative help in.
Yeah.
Do you have any such ideas that there could be pressing priority conditions where you think it'll be good to review all the evidence and put it into form of an evidence guideline?
Yes, looking at the existing programs and the activities, there are so many areas that we can do further, systematic review, or the other kind of research as studies to fix it. Like, as for example, we can see, like, we have a antimicrobial resistance. It's increasing day by day. So we can do a bit more research, or systematic review on then how we can overcome this antimicrobial resistance. The another area is vaccine. So kids are getting these vaccines, but if you see the effectiveness and the efficiency of these vaccines, it's a very questionable. That is the another big area. And then we have a blanket kind of programs, like deworming. So everybody is getting this deworming tablets periodically, whether it is effective or not. Even we have got this information from the Cochrane review, but the people here, they haven't realized, like, this is a very blanket, and then it's not a specific, and it's the wastage of the resources, or there is a little value for money. But the people are not convinced in a proper way. So maybe if we develop this center, and then if we enroll our own data on that, and then the people realize that, yes, it's not a value for money kind of things. So there are so many things, like if you see the health systems, like human resources for health, it's a critical, we have a critical crisis, especially in the rural areas. So what are the proper, what are the specific determinants that the health workers, or the physicians, or doctors, nurses, they are not that much attractive to be there in the rural areas. So if we get this you know get this answer, like answer in a systematic way, supporting by the local evidences, then I think it is easy to convince our policymakers, decision makers, to change their legal frameworks, or policies and the guidelines. So there are so many areas that we have to do.
Through all what you said, I seem to sense that there is a felt need that we require local evidence to make
Yes,
these decisions.
exactly.
And so, what you might need to then figure is help us to understand how we can use global evidence to
Yes.
help fuel this whole process of arriving at what would be considered a local evidence.
That's really important. Like, I have also realized, like, we have a very good kind of strong evidences that generated at the global level. But what I've sensed, like, the policymakers, decision makers, they don't have the good access to these global standard evidences, because they don't have time to go through these old journals and everything, no. So if we have if we translate those evidences into a policy brief, or a small kind of fact sheet like things, and then if we talk with those policymakers in a day-to-day basis, or if we organize some sort of mechanism that they will get this sort of evidences in a day-to-day basis, or in a periodic basis, and discuss on this matter. And then if we translate those strong evidences into the local language, like, as for example, in a Nepali language, or in a very simple English language, or even in the other languages, other dialects, then that will go to the communities also, that will go to the beneficiaries also, and that will go to the managers, local managers also, and then they create some sort of voices, like, this is the evidences, then why you are not following these evidences, and then that creates some sort of supportive environment, or conducive environment to use those global evidences at the local level. So that's we have to do. The scientists, they have generated this sort of evidences very strongly, but the getting this gap here, like we are not able to translate those evidences into the local context, no. So that is the point, like
So I think that's interesting because what you're describing is the evidence policy gap. There
yes,
seems to be evidence, but how do you convert that evidence into a language and a format that
exactly,
policymakers can understand and appreciate is relevant to them?
exactly,
So would
exactly.
you think that if we have two things, one is if you have a central sort of a Cochrane Center
Yes,
here,
yes,
that could be devoted with the task of trying to find relevant evidence,
yes,
assessing it for its applicability,
yes,
translating it into policy
yeah,
documents of some
yeah,
sort,
yeah,
which you can even pilot test to see which one is suitable, and
yes,
then try and see whether it can be disseminated more widely so you create greater awareness, both
yes.
within the private as well as the public sector.
That is the, I think that is the idea. Like if you get this Cochrane Center here, then we will have a good interactions with the global evidences, and then we can translate those evidences into the local context, and we can test those evidences in a local context, and we can involve those policymakers, decision makers, and they are the managers, implementers, and then they can feel these evidences in a very close manner, and then they realize that yes, we are wrong, we have to follow this evidences. So if we will have this Cochrane Center, and then it's easy for all of us to to get them on board, and we can interact in a daily basis, and then we can utilize those evidences in a proper way, so that we will get this value for money of this all fundings programs, and we can change our or we can improve our health status in a very efficient way. So this is something we are hoping.
So that seems like something to look forward to, a goal we can try and
Yes.
achieve.
Yeah.
And I was wondering whether, as an interim step, the next workshop you should be having here is not one on generating evidence through systematic reviews, but learning how to, or learning together,
Yeah.
how we can translate existing evidence to answer gaps
Yeah.
in your knowledge, and what is the format we can do. So this evidence policy
Yes.
translation sort of thing, evidence through policy.
Exactly. That
That
is, I
would
think, that is really important, and this is, this is, I think, we have to consider as a priority one, so that we also can learn from that why these policy people or the implementers they are not taking care of this evidences, and then how can we make them or realize make a good realizations that we have to have these evidence-based policies and programs. So if we be able to organize that sort of workshops or the conference, I think that would be very nice, that they will at least realize that Cochrane can change our change in our life. Cochrane can change in our style of dealing the issues. So that is, I think, very important for Nepal like country.
That sounds very encouraging because that is exactly what you and
Yes,
Cochrane can help with. And
sure.
there are examples in India, for example, in October, in August, we're going to
Yeah,
launch
yeah.
uh, the Indian extrapulmonary tuberculosis guidelines,
Hmm.
which is based on a collaboration between Cochrane, the infectious diseases group, the
Yes.
effective healthcare program, Cochrane South Asia,
Mm-hmm.
and a whole lot of clinicians who deal with
Mm-hmm. Mm-hmm.
tuberculosis,
Mm-hmm.
plus the Ministry of Health Central TB
Yeah.
division.
Yeah.
So we all sat together
Yeah.
and determined what our parameters and came up with that sort of
Sure.
guidelines.
Yeah.
So that's my hope that Cochrane Nepal
Yeah.
will ultimately be able to
Definitely.
take in
Definitely.
this.
Looking at this, tuberculosis also, we have a, increasing XDR even in Nepal. That's, if the India can do that, and then if we get this evidences from India also, I think, we can use that in our guidelines, in our protocols also, and then we can, influence those, people who are working on the ground, that, we have to change these protocols or guidelines. Otherwise, we will have a large number of XDR tuberculosis in the country also. So these are some issues, like there are so many areas that we have to look into, and then we have to inform our policymakers, decision makers in a right way that you have to do it. So this sort of interactions, I think we should have periodic basis, and then we should bring them on a board.
How do we strengthen the links between the evidence community from Cochrane and NHRC, as well as the ministry? I suppose that the actual decisions will be made by the ministry,
Yeah.
with the NHRC serving an advisory technical capacity.
Yeah. So I think this is not that much a big deal. Like Nepal Health Research Council as an independent organizations, apex and autonomous, and the established by a law. So we have some sort of mandate that we can utilize for our own benefits, for our the country's benefits, and the directly we can we can have collaborations with the Cochrane centers or any other organizations. So that's we can link in our own capacity. But definitely when we do it for the government of Nepal, and then it is the channel of this all evidences or whatever we generate in NHRC, the channel is the Minister of Health. So definitely we should take them on a board, and it's not that much a difficult task for us. Like we can request this Minister of Health, the planning policy divisions, and even the ministers for collaborating these issues. So we should take them on a board, but legally it's not a big deal for linking, coordinating, and getting this collaborations with different organizations. So I think with our own capacity we can do it, but definitely we should take them all on board, so that in futures we can work with them, and they realize that this is for us and for the country. So this is something we have to have.
That's very encouraging, and
Yes.
we're hoping that we'll be able to invite Nepal Health Research Council to come to India in August when we
Sure.
launch the extra technical
That's our
guidelines.
pleasure.
And we
That's our
could have
pleasure.
further discussions, because we're hoping that more people from Cochrane will come for that.
Sure. Sure.
And let's
Thank
hope
you.
that will move towards a brighter future when we work together.
That's our pleasure. That's our pleasure, and we
So
are quite eager.
I'm looking forward to speaking to you in the next capacity in Cochrane, Nepal.
Sure. Sure.
Thank you
So
very
thank
much,
you.
sir.
Thank you.